we're in South Louisiana. Anyone who's got allergies, take this.
NAD is probably the biggest thing coming out right now on anti-aging. Normally, like when we're tight in here and you start getting that pressure and you're taking those joints and muscles through full range, this one feels almost addicting. So consistency over intensity. And then we're just going to roll up and down. It seems crazy, but when you go get massages and they're finding tightness in here, the first thing you need to do is start releasing this stuff. Kelly, thank you. You did the exercises last week and it helped a lot.
Good day. How's everybody doing? Happy Wednesday. Please drop me a line and make sure that you can hear me. Make sure everybody's got me. Say hi. Hope y'all are doing amazing on this Wednesday. Welcome to Tea with Dr. D. I'm wrapping up. This is like my last little sip or two of yerba mate. I've had a lot of you ask me about yerba mate lately. It is my favorite, like, brain focus, like, tea. If you do any type of studying or writing, yerba mate is definitely my go-to with that. I use Cruz de Malta is my favorite brand of yerba mate. So I sent that to a couple of my patients recently. I hope y'all are getting as much out of it as I can. So every month I do this Tea with Dr. D. I'm Dr. Derek Hines. I'm the founder of Acadiana Pain and Performance. And I come on here and answer your questions about health or anything you got. Maybe it's tea related, right? You can text those to us, 801-691-7582. And we answer your questions. And we actually, if you do send us a question, have a special little, let's call it a gift for you for people who are asking questions or sending any questions in. So there's some good stuff with that. And we take those and like try and answer them as much as we can. Obviously, if it's urgent and somebody's got something going on, hey, come, let's have a real conversation about how we can get relief if it is there. But I get questions about supplements. I get questions about everything that you can think of. So don't be afraid to send any questions in there. So let's dive in. Drop me a line, drop me a question as we're going through some of the questions that were submitted early, and we can jump to them. JSN 56, thank you. What does optimal hydration look like? I appreciate this question. I had released a video recently and there was a little confusion. My fault. I take blame for this. I misspoke in the video. There's two ways to do hydration. One way is the easy way. Take your body weight, divide it in half, and drink about that much in terms of ounces. So this is where the confusion came from. So if I weigh 150 pounds, I'll drink 75 ounces of water in a day. Easy. That's the easy way to do it. Start with at least that. If we really want to get particular, when we look at what the water molecule is used for in the body, it does help us convert fuel into energy. So basically we would need 1 milliliter of water per 1 calorie of food. So if you eat 2,000 calories, you would need 2,000 milliliters of water. That's kind of the sciencey way of deciding how much water we should get. Start with the half of the body weight. Don't miss that. And then if you're working out, if you're sweating, go up from there. If you really want to tune it in, then we want to look at how many calories are we eating? Are we trying to lose weight? Are we changing some of those things? Then we could really get nerdy on it. I will say there's a lot that influences hydration, such as electrolyte balance. Are we absorbing the water that we're taking in? I have my little morning cocktail, as I call it, that I drink that has green juice, a hydrogen tablet in there, and creatine. So, and I do a little bit of like Himalayan salt. All of that gives you this like perfect way of pulling hydration into the tissues, into your bloodstream, into the body. So there's an easy way of getting this early win right in the morning. You wake up, go fill the glass up, drop your creatine, a little pinch of like sea salt or something like that. If you want to get real fancy, drop a little hydrogen tablet in there and you're getting a lot of really good stuff in your hydration. So start with half the body weight. If you want to get super nerdy about it, go to kind of 1 milliliter per calorie that you eat. But thank you. Hopefully that clears that up. I know that I apologize. That was a slight bit confusing there. Thank you. Hey everybody. How are y'all? Thank y'all for joining me. Drop us a line. Say hi. Kale, I have nerve pain behind my shoulder blade. Beautiful. Okay. I assume you don't want that anymore. So actually, let's see. Give me 2 seconds. I'm gonna see if I can pull this up for you. That's a weird area. And I think a lot of people get this, like we sit so much and we're kind of in this like rounded position that we start to create some compression. Okay. I don't know if this is going to work, but we're going to give it a shot. Okay. So if we look at this, you can see that there's this little nerve that passes right behind the shoulder blade itself. And it's almost sandwiched between your shoulder blade and the rib cage. So what happens for a lot of us, if we add some muscles to this, is that some of these muscles start to create compression and pull our rib cage up. Actually, it almost pulls the ribs into this like upward bucket handle position. So we raise those ribs up, and what they end up doing is smashing that nerve between the rib and the shoulder blade itself. We need to do a few things to get rid of that. We first need to take pressure off of that nerve. I've seen people who go and get like massages and they're trying to work the knots out where that nerve passes on the inside of your shoulder blade. What you need to do with that is make sure that you're getting those ribs moving again. If they've been stuck up in this position and we're sitting in kind of that hunched over posture for a long time, they can kind of get really stuck and the muscles on top of them can start to shorten and tighten. So you want to get some version of like manual therapy to get those ribs moving so that they're not pressing that nerve up into the shoulder blade. Once you do that, so you could even take like a little mobility ball and put it right on the inside of that shoulder blade and start rolling those ribs out. And like, if you get right on the spot that feels like it's almost pinching, hold that spot with the little mobility ball on there and just do some really deep breathing so that we can start to get the rib motion back. So it's not pressing on the nerve. Then what you can do is make sure that we're strengthening the lower trap muscles. So that's the one like that helps pull my shoulder blades back and down so that I'm not like hunched over a little bit, putting pressure on that nerve. If you're having nerve pain there and that nerve's inflamed, what we do for a lot of people is we put them on something called PEA. Y'all have heard me talk about this 1,000 times on here. PEA is a really powerful nerve anti-inflammatory. And if the nerve is just inflamed because it got pinched, you could take a good PEA supplement, and within a few days, the swelling and irritation and inflammation at the nerve will go away. If there's actual nerve damage or nerve injuries, we actually combine it with a couple of peptides. If it's just inflamed, the combination of KPV, a peptide that helps a lot with systemic inflammation, and PEA put together are incredible. To get inflammation at the nerves down, that stack of PEA and KPV is the best thing I've ever seen to reduce nerve inflammation. So that's the, like, let's get the cause there, make sure we're not pinching that nerve anymore. Then let's add in, if we're still having symptoms, add in a chemical way of reducing nerve inflammation. This isn't blocking inflammation. This isn't going to work the same way that like an NSAID would. This actually helps to address the root ability of your body to process inflammation to actually heal the nerve. We don't want to block it. We need that to happen to heal correctly, but we also want to make sure that we are clearing that out and not letting the nerves just stay swollen and inflamed. So hopefully that helps. That's a really good routine. if some of that stuff doesn't work, you might need a little more aggressive treatment to it. And you can get with a good practitioner who's going to do a big, hands-on assessment, and they're going to make sure they get you moving around and find out what's happening to compress the nerve. So hopefully that helps, Kale. I appreciate the question. All right. So let's look. Yvette, PEA was a miracle drug, spinal surgery, three spinal surgeries. It's a game changer. Yeah, I agree. The studies on PEA are great. When you look at it, that the studies on sciatica, the studies on carpal tunnel, there's a bunch. They've got a few on thoracic outlet. All the studies are really good in what it can do. If you've had like nerve inflammation or irritation, there's good data on this compound to help your body process inflammation, especially at the nerve and the brain. And if it's a serious thing that you've even tried like gabapentin or any of these major kind of drugs for, the combination of KPV and PEA is just incredible. I've seen few things that could reduce significant nerve inflammation the way that those can, better than any pharmaceuticals that I have seen to actually address the inflammation in the nerve itself. So yeah, thanks for that. I appreciate you sharing some of that stuff. We have a lot of patients who still have nerve pain after a surgery, and most of that is probably because even the injury that caused the surgery was creating inflammation in the nerves, and then the surgery itself can create some trauma around the nerves. We're moving stuff around, we're stretching and pulling the nerves. They can get injured in that process, and we see it a lot. So we want to make sure that we're getting some of that stuff cleared up. So thank you, Yvette. I appreciate that, my dear. Hey, Kim, how are you? Thank you for the question. What can I do on days when I sleep poorly? It seems to make everything spiral from pain to energy and mental health. Sleep is one of my favorite topics. You know that. You're probably putting that after hearing me talk about some of these things. So yeah, look, we know that we need to get good sleep, right? Y'all have heard me talk about this on here a ton. And can I get sleep, beyond the 7.5 hour mark? That seems to be what the studies show. But what if I don't get that? Can I stop the spiral from happening? And that's a really good question. There was a bunch of studies that came out recently on the power of creatine for this purpose. So there was a study where they took a group of females specifically. I have no reason to believe that this would be gender related, but they just so happened to study females, and they underslept them. They did not allow them to sleep more than 4 hours, if I remember correctly. Don't quote me on that exactly, but and what they did was they supplemented them with 25 grams of creatine. That's a decent amount of creatine, to be honest. That's more, most of the time we're taking like 5 grams of creatine a day. What we want to do with that is know that we're probably going to kind of go into that amount and come back out. But so they took 25 grams of creatine, and what they found was that it mitigated almost all of the negative effects of the poor night's sleep, even like the kind of sharp trigger, the stress, any upregulation of anxiety, some of the hormones, some of the mental focus issues, and certainly the performance issues that we see when people are underslept, when they don't sleep well enough. We see all these negative things happen. And in this one study, what they found was if they supplemented with extra creatine on that day, you mitigated most of the sleep issues. So that's an easy thing that we can all do. Y'all, the more and more we talk about it, I love creatine. I think many of us, it's low hanging fruit. It's cheap. It's easy. Take creatine if you want to continue to be active and have good brain and muscle health. So yeah, a few of y'all. The other thing I would say is like, do some like in a non-sleep deep rest throughout the day. Even if you just hang out and you do some like breathing. We have a lot of people who will call us and come and get 20 minutes on the PEMF and infrared mat. That's considered something called non-sleep deep rest, NSDR. For a lot of that, it is very helpful to spend a few minutes breathing while you're doing it. So I love like doing like 4-7-8 breathing. There was a study where they used 4-7-8. That's 4 seconds in, 7-second hold, 8-second out. So you're kind of doing this controlled breathing. And in people who did not sleep well, it brought anxiety down and it brought blood pressure down. So it was doing a physiological change just to spend some time. I think the study was 5 minutes doing some breathing exercises. So that's a very easy thing that we could work in. Do some creatine, do some non-sleep deep rest, almost like meditation, some breathing exercises with that. And then prioritize sleep going forward, right? You're going to need to try to quote unquote catch up. A lot of that is just the brain and the hormone system trying to get back regulated. If those days start to stack up, then we need to talk about changing some sleep patterns. But I think those 3 things would work really, really well to mitigate any negative effects from like a 1 day slept bad. I've got a lot to do. Let me make sure that I am, performing optimally, doing a little quick breathing session in the morning, take some creatine, and try and work in a little 20-minute NSDR session throughout the day. So that'd be my quick and dirty exercises, if you will. Hey, Heather, how are you, my dear? I hope you're doing great. Best way to lower inflammation in your body. That's a great question. I think we would work through kind of the full like foundations first. So is our environment in some way contributing to inflammation? We're in the South. I was having a conversation today that like, look, we do have to look at, am I putting anything in my body that's creating inflammation? So food, what's my water source? Am I drinking quality water? Am I staying away from any inflammatory things? Even for me, that's that's a test that we could run. So like, do we have any food sensitivities that we might need to know of? Am I sleeping in a good environment? Do I not have any like mold or any like toxicity around any of that type of stuff that would cause inflammation? Once we've checked that I'm making sure that the food I eat, the liquids that I drink, the environment that I live in is not causing inflammation in my body. Then we can start looking at how do I get ahead of it? What I was saying earlier, the combination of KPV, which is a peptide, and PEA is really powerful at helping your body process systemic inflammation. So this isn't the inflammation that's in like, a shoulder or a knee. There are some things that we can do with that, but just somebody who's got like a high C-reactive protein. For those of y'all listening, C-reactive protein is how we measure it on a blood test usually, or at least one of the ways. If that's high, then we would want to like add some things to help the body process it. KPV and PEA do a really good job. The most impactful thing I've ever seen for somebody is fasting mimicking. Y'all have all heard me talk about this a lot on here. We use Prolon or some version of Prolon, which is 5 days. People start to eat a progressively lower calorie fasting mimicking program. So you're feeding your body enough to not lose muscle mass, but your body is still getting all those benefits of fasting. And when we dip into fasting state, any cells that are not serving us, our body eats for fuel. These are inflammatory cells. These are kind of precancerous cells, damaged DNA cells. Any of that type of cell, our body attacks first and eats those things. I have seen multiple patients go from a C-reactive protein above like a 5 or 6 high. That's high. We want it less than 1. After doing one 5-day fasting mimicking program each month for 3 months. These are the studies that Dr. Walter Longo did. So they did 90 days of this. And just doing the fasting thing, I've seen them take a C-reactive protein from like a 5 or 6 down to below a 1, to within normal limits. I've seen some people take it from like a 14, crazy high systemic inflammation, down to like a 3 or a 4, which is like, look, we're not there yet. And that was just doing the fasting mimicking program. One of the things I would love to study, and if anybody researching wants to jump out and talk to us about this, is the combination of advanced peptide treatment with the fasting mimicking diet over a 90-day period. I think almost regardless, if we check those boxes of like, am I eating and making sure I'm not causing inflammation in my body? If I check that box and then I do 90 days of a peptide protocol and I do the 3 once a month, it's just 5 days a month of the fasting mimicking program, I think we would see just dramatic changes in systemic inflammation levels. So I know that's a lot, but that's what we see to be really effective, even on their own. I've seen KPV and PEA do incredible things to reduce it. I've seen the fasting mimicking program bring inflammation down. It's just, if we're really trying to get ahead of these things, you would say like, okay, let me put the best things together for this period of time, so I'm resetting the inflammatory processes inside my body. So I hope that helps. I hope that makes sense and not too much. Hey, Penny, how are you, my dear? How much creatine for a 64-year-old female? I would start at 5 grams a day. I think that's the easy place to start. That's what I take every day. And then almost based on how I'm feeling, to be completely honest with you, we go up or down. So some of the studies on brain health, particularly in women, started to climb up into the 10 and 15 grams a day. The creatine that we use, like 1 scoop is 5 grams. So because of some of that research on brain health, I have some days where if I didn't sleep my like 7.5, 8 hours, that I'm shooting for probably 10 or 15 grams. So I'll do my 1 scoop in the morning. I do a little green juice kind of stuff. I'll throw a scoop in there, and you might do 1 in the early afternoon if you're really paying attention to brain health, or if that's on the priority list. But I would at minimum do 5 grams a day. And then titrate up from there to get some of the more brain health benefits. Most of the 5 gram a day was all for like muscular energy, right? It's only been in the last decade or so that we started seeing more and more research on creatine coming out for what it can do for us brain wise. And we've seen like focus, we've seen it mitigating changes in memory. We've seen more recently changes in like stress and anxiety responses. So it's one of those supplements that's just held the test of time. I mean, we started hearing of creatine in like the 90s, and it's been tested and beat down for 25 years, and it's passed the test of time in terms of research. You don't need anything special. Get a good creatine monohydrate. It shouldn't be a crazy expensive thing. If you see a bunch of other things added to it, that's mostly going to be marketing. That's somebody trying to like make you spend more on something. All these studies that show health benefits are on creatine monohydrate. So like, I don't know, a month supply shouldn't cost you more than 20, 25 bucks at the most. And that's probably high, to be completely honest, but very, very helpful, very powerful. Start at 5 grams a day. Maybe 15 to 20 if you're not sleeping well and you really want great mental benefits, if you will. I think more than 25, I would start to get a little bit. Let's pay attention to that. I wouldn't go long term more than 25 grams a day. With what we know right now, I could completely change that in like a year if they're like, hey, we don't see anything and all we see is brain benefits from that. But that's my starting point. Don't go below 5 grams. Jennifer Street, no breathing works. Well, I think most of the world would beg to differ on that. But thank you. I think breathing works for us. Okay. I guess we'd have to define a few things. I hate when people say this. Look, to each their own. I think if you've tried breathing techniques, what was your outcome? What were you trying to achieve from it? If you didn't find that it was doing that, there's a lot of ways to skin a cat, as they say. Try some other things if you were looking for the stress benefits. Hard to beat exercise, right? Hard to beat kind of getting out and moving the body and forcing the breathing to happen naturally. If you look at like The 4-7-8 breathing, there's tons of studies on that. There was a study that was done on obesity patients that showed that it reduced blood pressure, it reduced cardiovascular risk. There was a study done on anxiety that showed doing 4-7-8 breaths reduced stress and anxiety as well. The physiological sigh is just when you go, just like deep breath in, top it off, and then just let it out. And doing that for 5 minutes. Stanford did a study on this. 5 minutes of that reduced stress, anxiety, and improved mood. Doing a physiological sigh for 5 minutes a day. So most of the research would say that that's not true, Jennifer, but it might not be true for you. So by and large, the research says that if we are doing some version of conscious breathing, depending on type, you can definitely tap into some of your physiological responses on that and make some really good improvements in different areas. With that said, if it's not working for you, try something different. I see so many people in different worlds of health that if we say one thing works for everybody, I promise it's not going to be true. But we do try and find the things that have a lot of bang for buck. And I do find there's some type of breathing that works for most people to help improve energy, recovery, stress, performance. So I'm sorry to hear that. Find something else that works depending on what you're trying to do. I don't have a ton of context with that, but hopefully that helps. Hey, Chuck, how are you, my man? I've got degenerative changes in my hip. Is there anything I can do to avoid surgery? Tough to say without somebody getting their hands on that and seeing what function is missing. You know, we use these images a lot where somebody says you've got degenerative changes or you have a severe disc bulge. I think the severity of all of these things comes from the symptoms that they're causing, not what the image looks like. So that's my starting point, is like, I have patients who have severe degenerative changes in certain things. And guess what? They get to where there's no pain at all. Well, then would you say it's severe? You would say like the size of it's not what we want, but we can absolutely function and do everything we want. Hey, that's great. So that's my one kind of caveat to this. I do see a lot of improvements around the hip when we're looking at trying to help with degenerative changes. So I was laughing because I have one of my patients who's going through a full like regen protocol. So he's doing BPC, doing TB500, which is a peptide that helps kind of regenerate healthy cartilage and healthy tissue as much as we can in combination with treatment. And we were talking, and he was showing me his leg movement, and he's just moving the hip around in ways that I haven't seen him move in a long time. And we get to the point where it's like, okay, well, those degenerative changes might still be there. They might, and they might not change. But all of the research that we currently have says if you can function well and do everything you want and you're not having pain, that you should not go and do some version of a procedure for that. And so I think if you address the underlying mobility issues, the stability of your hip, and then the inflammation, and heal as much of the tissue and compression around the hip joint itself. So find a practitioner who's going to do some hands-on stuff. They're going to get into that hip joint. They're going to need to do some form of needling to get there, I would think, to actually make big changes and release abnormal tension around the hip. And then they're going to help you progress through a movement correction program to actually get that hip moving better so that you can function. We don't want one without the other. And this is the problem with surgery, is it's focused mainly just on the tissue, not the function. So we want to make sure we get all the tissue as healthy as you can while we build up the function of your hip so you can do everything you want to do. And if we can get you to that point pain-free, or at least pain-limited, and you're doing everything you want and you feel good, I'm like, that's what the surgery is trying to get you to. If you're already there, let's not do surgery. And if you continue working that, a lot of people on this have heard me talk about my hip. I had a labral tear. They told me I needed surgery on it. I didn't have time at the moment to do the surgery. I was still in school, so I was going to lose like a year of school, and just started treating it. Luckily, I was going through a rotation where we were doing a lot of needling. They were treating my hip like 2-3 times a week. I started doing some strengthening stuff, and lo and behold, whatever this is, like 17 years later. I've never had surgery, 16 years, whatever that is. Never had surgery. My hip, I don't even think about it. It never bothered me. Completely healthy for all purposes, no matter what I'm doing, running, skiing, any of that stuff. And this was you have to have surgery. You don't. Now we might need to get kind of aggressive with it to find how to heal it, how to get the inflammation in the joint down. This is why we do so much advanced stuff. I love peptide therapy. BPC and TB500 would be your starting point. As I was saying earlier, if we really think inflammation is an issue, we might want to put PEA in there. It's really helpful for it. And then beyond that, it's starting to rebuild the strength around all of the tissue in there. So hopefully that helps. You can absolutely avoid surgery, Chuck. Hey, Jamie, how are you? I hope you are doing awesome. Thank you for the question. So what does it mean when I lift my arms above my shoulder? So I'm assuming like this, like reaching up, and I hear a pop in my shoulder blade. So that's probably a stability. It doesn't hurt, but it pops. So there's going to be two answers to this question. If we look in research and they say that there is a non-painful pop with a movement, the research would say, oh, well, that doesn't mean anything. It doesn't point to a progression of any type of arthritic changes throughout your life or any issues later on. That's what the studies would say. Now, I would say if it was completely healthy, we probably wouldn't have that pop. If it was moving and stable in take like a child, like everything's perfect, would it pop? Probably not. So I don't think it means anything severe that we need to be super nervous about, but I do think it means something. So if we're doing it in specific motions, a lot of times what it means is that I'm not strong enough in some pattern to stabilize the shoulder blade as I increase even gravity through that motion. So a lot of times what we want to do is go through a program to start stabilizing the shoulder blade and get that checked out. Like, are we getting a little bit of a kind of winging scapula as we go through that motion, flexion, scaption, abduction, raising to the side? How does my body stabilize my shoulder blade on my thorax, on the shoulders, or on the trunk, if you will? So I would, like, regardless of what's going on there, if you're not having pain, I would make a point of starting to do some shoulder stability exercises. I love the swimmer. So if you're laying on your stomach, like on the ground, and you raise your arms off the ground and you just start going up and down, within about 10 reps, you're going to feel some burning through those muscles. Really, really good. I really do like just the typical rotation exercises, external rotation with a band by your side, external rotation with a band, very helpful. And then my favorite stability exercise, if you can do it without popping, is something called a Turkish get up. You start super light, laying on your back with your arm out straight. And then you come up on your elbow, and your arm is always pointed at the ceiling. And it teaches you how to stabilize that shoulder throughout motions. So look up a Turkish get up. They have some really good, like, how to progress through it. I wouldn't worry about it in terms of like it's a problem or anything like that. Don't let it make you scared to move or any of that type of stuff. We know that that's all bad. It's not that. I would just make a point of saying, hey, this isn't as stable as I want it. You know, I'm going to have a day or two a week where I'm focused on shoulder stability for a little while, to make sure that my body can stabilize the whole shoulder complex, the shoulder blade on there, making sure that I can move that through a position without causing any problem. So I hope that helps. It's not a bad thing. Don't let it scare you. Just start working on some stability in there so that your body can do that. Beautiful. Chuck, I hope you got the rest of the information. Thank y'all so much. I hope this helped give y'all some version of information or thoughts. We try and do these every month. We do these every month. It just depends on if they're on Wednesday or Tuesday, depending on my schedule. But it's always the last week of the month. So thank y'all. Any way we can get help to people, I really appreciate it. Getting people on here and sharing any information, giving people hope. If anybody needs more than that, let us know. We're here to help. Our team is there to help get as many people possible hope, help them experience healing, and help them live healthy. So I hope y'all have a great day. Everybody stay safe for Labor Day. Stay safe getting out for the football games. Go Cajuns, go Tigers. Eventually, go Saints. We'll see how that goes. But have a great evening, everybody. I appreciate y'all.